Welcome to our series of short educational presentations on managing medical inventory in different settings. Today we look at the difficulties of managing inventory in the ASC setting and discuss why supply chain management is such a difficult task in the ambulatory care sector. We'll also look at new technology that's adding speed and efficiency to this task. So, let's take a look at some of the reasons that managing inventory in the ASC setting is such a challenge. Multi-specialty ASCs use a wide range of medical inventory for different types of procedures and surgeries. They'll need to keep track of this stock and ensure that every reportable and billable item is tracked efficiently while it's in stock and when it's consumed. Management of this complex inventory may or may not involve a dedicated materials manager. Many smaller ASCs operate with nursing and backroom staff managing this function. Because it's not easy to keep track of every item, many can suffer from surpluses, shortages and stockouts, which can of course impact on the provision of prompt patient care. The current technology and systems used to manage inventory, such as barcode scanning and manual keying in of data, have very real limitations when it comes to dealing with the real-world problems of operating rooms. What's needed is a solution that can achieve end-to-end tracking and charge capture of every type of item, including owned stock, consignment and bill-only items. Let's look at how IDENTI Medical tackles inventory tracking in the ambulatory care sector. First of all, it's important to recognise that different types of item are monitored in different ways. Some high-dollar items will be RFID tagged. Other items, like trunk stock, may arrive directly to the point of care. Any system documenting consumption will need to be able to deal with all types of stock, however they are tracked. The system should be suited to different clinical environments, as each has its own needs. The storage location is also important. Is it stored in a cabinet or on the storeroom shelves? The best inventory management systems can offer a solution to all types of stock stored in different locations. IDENTI's RFID Smart Cabinet comes in a range of configurations to suit different settings. The TotalSense system is an automated item-level tracking system that helps providers to comply with UDI regulations and track all activity, both for products and users. So let's look at the technology. TotalSense is a UHF RFID smart cabinet that perpetually tracks every item, reports on inventory levels, and monitors expiry. It records when items are removed from the cabinet, including the user who took them. The technology can be shared with partners such as vendors, distributors and GPOs, making it ideal for pain-free consignment management as well as locally owned stock management. Inventory that's not in the cabinet but sits on the shelves can also be tracked. IDENTI's TotalSense Mobile turns storerooms into a virtual smart cabinet. Using RFID tags, a mobile scanner and our AI cloud technology ensures comprehensive stock management for items in the cabinet or on the shelves. At IDENTI Medical, we can help you in several ways. We can give you complete visibility and control of your inventory and ensure that prompt and accurate data is available for improved management and planning. We can help you manage expiry and reduce wastage and to streamline the inventory for reduced case costs and supply chain expenditure. And most importantly, we can ensure that patients have the right stock available at the right time and that items are monitored carefully to prevent unsafe items from accidentally being used. IDENTI Medical has created the next generation of medical inventory management using advanced data sensing hardware and AI cloud software that taps into a global SKU database and is fully interoperable with hospital systems. And what about the point of use? Currently, existing systems over-rely on busy nurses and are too barcode dependent. They're held back by clunky software and constrained by out-of-date catalogues. It's time for an upgrade. IDENTI's documentation solution for ASCs brings the barcode era to an end and heralds in a brand new way of capturing utilization data by recording an image of the product packet or label. At IDENTI, we don't scan, we snap and go. So let's find out about Snap&Go. Our next generation point of use utilization documentation tool uses image recognition technology and turns item capture into a 3-second task. It delivers automatic item identification via a globally populated SKU database supported by a human back office, ensuring that every item is identified, whether it finds a match in the item master or not, whether it's a stock item or not, whether it's barcoded or not. The AI platform produces metrics, reports and data analytics to improve healthcare management and margins. And we understand the needs of different departments. For example, in orthopaedic areas, we have a way to record the nuts, bolts and screws used in surgery. Our system can read handwritten implant sheets, making it easy to digitally record the small consumables used in surgery. Just look at the power of 100% data collection. 10 to 20% increase in reimbursement, 70% or higher reduction in wastage, 30 to 40% reduction in nurse admin time, 25% reduction in inventory, and more. Data is central to modern healthcare management. It's the gas that feeds vital workflows and informs management decision-making. Snap&Go is fully interoperable with existing systems such as the ERP, EHR and MMIS, so that data is fed into operational workflows for maximum efficiency across the organisation. IDENTI has reimagined supply chain data collection, giving you inventory data sensing tools, automated product identification via a global virtual database, and vital point of use data to drive through efficiencies and improve organisational performance. So that's the IDENTI system. Advanced data sensing tools, virtual data identification, and data you can use. If you're struggling with an inefficient inventory management system and inadequate point-of-use product usage documentation tools, it's time to join the image-to-data revolution.